Namaskar, this is Dr. Mona. I'm a naturotherapist and diet consultant since last 17 years in Mumbai. So, these are the basic types when you are going to your doctor, when you consult your eye specialist, they can bifurcate this type of glaucoma in different categories and accordingly they'll treat you the type of medication or the therapy, right? So, generally, basic signs and symptoms of glaucoma. Initially, basically, see, glaucoma, as I told you, a group of disease. It's a progressive or gradual problem. Glaucoma is nothing like it diagnosed in a day one or two. That's why always when we talk about the eyesight problem, we always see a single sentence. Prevention is better than cure. Once you started feeling some vision problem, go and consult your doctor. Do the necessary test for that. Because initially, if you prevent your eyesight or vision, there is very less possibility of any other eye ailments or the blindness. Generally, the damage of nerves creates the problem that you can say there are two main cells in our eyes which is responsible for vision. So there is a rod and cone cells. So when the rod cells are more affected, glaucoma creates, because rod cells are the responsible to see the vision clearly. So when this fluid increased, rod cells are affected and due to that vision problems are created. But as such, the research says 99.5% glaucoma can be handled with proper medication. Only 0.5% of cases are there where the patient completely lose their eyesight or they become the blind. So it is alarming thing, but not the threatening things. 99.5% you can say you are on a safer side, or with the minimal vision at least a person can able to see throughout the life. Of course, with the aging process, this eyesight becomes naturally less or lower down. The angle of visions become more and more narrowing as per the age related problem. But still, only 0.5% cases are not treated, or you can say in 0.5% of cases they can face total blindness. So basic signs and symptoms in these cases are mild eye pains, redness in the eyes, little blur vision. Photophobia is again the reason, like suddenly some type of flashlight or heavy lights comes on your eyesight and you are irritated with that thing. You can't see, you can't open the eyes in that type of flashes. That is called the photophobia. Then difficulty in color perceptions, nausea and vomiting sometimes, edema of cornea, and pupil dilation. These are the signs and symptoms. So whenever a patient or a person started feeling this type of signs and symptoms, they immediately need to consult their eye specialist or ophthalmologist, so that in the initial stage you can detect your problem and cure that problem. There are certain type of steroid drugs which are also responsible if you use for a long period of time. You can see side effects of that thing also. Now, all these symptoms, after all these symptoms, how your doctor can diagnose. So what are the test or diagnostic system which is applicable for this problem? Initially, the ocular history, right? So any previous history of your eye related problem, family history, any type of injury or the infection of eyes, first of all this type of examination is needed. Then your doctor will do the tonometry test, which is again a measurement of your eye pressure, or you can say intraocular pressure measurement is called tonometry. Then there is a ophthalmoscopy, which is done only with your doctor. The doctor is only a person that can do this ophthalmoscopy to diagnose the vision left in your eyes. Gonioscopy, the another test is there. So to check the eye angle, this gonioscopy is used. Then visual field test is there. So peripheral visual loss detection can be made with this test. And the last test or another test you can say is the slit lamp examination that your doctor do to check the structure of your front eyes or the vision left in your eyes. So all these tests are only done by a proper eye specialist only. Thank you.